Shocking Health Department data published today by Bernard Lane's Gender Clinic News has revealed that last year more than 1,400 girls and young women were prescribed taxpayer-subsidised testosterone for a male health condition. The practice of dispensing testosterone for off-label use as a gender affirmation drug has become so widespread that there are more than 4 times as many girls aged 14 to 18 commencing PBS-funded testosterone for androgen deficiency than boys the same age. In the 19 to 23-year age group, more than 8 times as many young women commenced on PBS-funded testosterone for androgen deficiency than young men the same age. Appallingly, gender-affirming doctors are telling the PBS that the drugs are being given to girls to treat an established testicular disorder. Authorities should be urgently investigating why thousands more young women every year are being prescribed taxpayer-subsidised drugs with irreversible side effects to be used off-label by young women and girls on the false grounds that they have a male health issue. One of the questions that should be investigated is whether taxpayers are being defrauded. And I use that word very deliberately because doctors and young patients are being advised by lobby groups to use the PBS authority indication androgen deficiency due to an established testicular disorder. This is to get around the fact that prescribing testosterone to masculinise appearance and characteristics is not an acceptable use under the PBS. This is occurring at a time when more and more detransitioners are speaking out about the devastating lifelong impacts of these drugs and the dangerous mastectomies and genital surgeries which often follow. How can the medical profession claim to be fully informing distressed young patients about the drugs they are told will help their gender dysphoria when those same doctors are simultaneously telling medical authorities they're prescribing the drugs to treat testicular disorders? The testicular disorder PBS loophole is being recommended to young people and doctors by the lobby group ACON on its TransHub website, alongside a list of gender-affirming doctors and a template letter for a patient to hand to their doctor to ask for hormones. As I've told the Senate previously, more than 30 federal government departments have been paying membership fees to ACON, which helps fund content like this, including some, like the Department of Defence, which have been major sponsors. Lobbyists encouraging GPs to use this loophole to prescribe taxpayer-subsidised testosterone to young women and girls point to the Australian position statement on the hormonal management of adult transgender and gender-diverse individuals, which was published in 2019. For example, ACON's TransHub website tells patients and doctors that the position statement does recommend targeting trough total testosterone levels in the lower end of the male reference interval. Yet if you read the position statement they're quoting to doctors and patients, that recommendation is accompanied by a note that the recommendation is weak and based on very low evidence quality. Is it any wonder that medical insurers in Australia and around the world are starting to worry about the inevitable lawsuits and medical malpractice scandals? Thousands of young Australian women and girls under 18 are being prescribed a drug which has permanent and irreversible impacts on their bodies, while our medical authorities turn a blind eye to the manipulating of the PBS to have taxpayers pay for it. As reporting from The Age's Michael Blanchard this week showed, young Australians are now increasingly being pushed towards GPs to access gender-affirming treatment. ACON's TransHub website is very explicit about this. It says you are able to access hormones from your regular GP or sexual health doctor. Hormonal affirmation and advice is not a specialist field and does not require an expensive or difficult process or access to a specialist to prescribe. ACON then goes on to describe the tactic of doctors claiming a female patient has an established testicular disorder to enable a taxpayer subsidy for these drugs. Because of these tactics we have in Australia, an explosion in the number of girls and young women from the age of 14 using off-label drugs to enact permanent and irreversible changes, even as other countries have woken up to the dangers because of the extremely low evidence-based and the devastating side effects detransitioners are now living with.